Hello, my name is Yaris Curtis, and today I'll be talking to you about the role and benefit of exercise for the management of breast cancer. Breast cancer is the most frequently diagnosed cancer in Australia, with an incident rate of 1 in 8 women diagnosed in their lifetime. Treatment to remove the carcinoma can include surgery, radiation therapy, chemotherapy, and other medication therapies. All methods have been found to be effective for increasing survivorship. However, the adverse effects of breast cancer treatment can also increase chronic side effects such as fatigue, pain, lymphedema, anemia, weight loss, bone weakness, deconditioning, anxiety, and depression, which all contribute to a decrease in overall quality of life and sense of control. Exercise is associated with many health benefits, and women should be encouraged to engage in regular physical activity during and after cancer treatment. Exercise physiologists are often underutilized when assisting patients with cancer treatment. Therefore, the main focus of this presentation is to communicate the evidence-based benefits of exercise for breast cancer. Some of the contraindications to testing and prescription may include cancer-related fatigue, bone and muscle pain, severe nausea, hemoglobin levels below 10, white blood cell count below 3,000, unsteady gait, cachexia, limiting dyspnea with exertion, and a fever above 38 degrees. However, data from a systematic review outlines that only approximately 3.5% of cancer survivors will experience an adverse event when exercising, suggesting that the potential benefits far outweigh the risk. So it is recommended that all exercise testing and prescription to be monitored and recorded professionally by a qualified exercise physiologist. Before any exercise prescription or delivery, objective testing should be performed in order to assess whether a patient can exercise safely and to determine their individual exercise tolerance and baseline. Some aerobic capacity testing may include submaximal or maximal exercise tests, such as the 6-minute walk, 2-minute step test, or a graded exercise test. Muscle strength and endurance tests may include grip strength, multiple RM using machine weights, or a functional sit-to-stand test. Additionally, flexibility testing such as active stretching or range of motion testing is also recommended. An exercise program consisting of a combination of aerobic resistance and flexibility is recommended. Aerobic should be completed 3 to 5 days per week at an intensity of 50 to 85% of heart rate reserve. However, this may need to be adjusted to below 50% during treatment phases. The recommended duration is the same amount as the general population following the national guidelines for adults, where they should do at least 150 minutes a week of moderate intensity or 75 minutes a week of vigorous intensity. Exercise can be continuous or intermittent. Several bouts of 10 minutes over the day is recommended to start and gradually increase as exercise tolerance increases. Resistance exercises should target all major muscle groups of the upper and lower body. Resistance training should be completed 2 to 3 days per week on non-consecutive days. Exercise volume should be 1 to 2 sets of 6 to 12 repetitions for about 6 to 9 exercises. An intensity of 50 to 70% of 1 RM for the lower body and 40 to 70% for 1 RM for the upper body. Gradual increase in resistance of 1.1 to 2.3 kilograms following 2 consecutive symptom-free sessions is recommended. Flexibility exercises such as stretching and yoga should be completed before and after exercise sessions. Stretching should be completed maximally for 30 to 60 seconds and repeated 2 to 3 sets. Any joint pain should be avoided. Special attention should be given to shoulder mobility stretches for breast cancer survivors. Recent studies show that a combination of aerobic resistance and range of motion exercises may reduce the severity of lymphedema in breast cancer survivors. Aerobic exercise has demonstrated to stimulate red blood cell production, which may improve anemia. Exercise is essential in reducing the risk of cardiovascular dysfunction, improving long-term health, and reducing the likelihood of cancer reoccurrence. Additionally, exercise has an important role in managing mental health by reducing anxiety, stress, depression, and improving mood. There is very good evidence for exercise during cancer treatment for enhancing functional capacity, physical and mental well-being, and quality of life.